Welcome to the Experts in Medicine Talk series. This series is brought to you by Handbooks in Healthcare, leading publisher of clinical pocket references by the world-leading medical experts. Today we are joined by Sergio Fazio, author of Contemporary Diagnosis and Management of Hypertriglyceridemia.
I'm Dr. Sergio Fazio, professor of medicine and pathology at Vanderbilt University in Nashville, Tennessee. I am the co-director of the Atherosclerosis Research Unit and the director of the Lipid Laboratory and Lipid Clinic. I've been working over the past 28 years on the causes of disturbances of lipid metabolism leading to inappropriate cholesterol and triglyceride levels or low HDL cholesterol levels, and lipid problems have been long ago linked to the main disease in Western societies, atherosclerosis-based cardiovascular disease. In the book Contemporary Diagnosis and Management of Hypertriglyceridemia, I have tried to put together information on triglycerides that have been sparsely collected in the literature. Namely, triglycerides are the main regulator of lipid metabolism, and in the book I have placed their proper positioning at the center of lipid metabolism, as initial alterations in triglyceride production, processing, and clearance influence HDL and LDL levels. The book also presents conditions that cause hypertriglyceridemia, such as obesity, hyperinsulinemia, diabetes, thyroid disease, liver and kidney disease, or the use of medications that can influence triglyceride metabolism. And finally, of course, the main intent is to connect the issue of hypertriglyceridemia with consequences in terms of disease, and the two highlighted are obviously the pancreatitis that can happen for very high elevations in triglycerides, and atherosclerosis, which may be linked to much more common and moderate elevations in triglycerides as part of a combined dyslipidemia that also includes inappropriate LDL and inappropriate HDL cholesterol levels. The new novelty of the book is in presenting triglycerides not as a secondary player, but as a primary actor in responding to changes in the body leading to this metabolism, and also a primary actor in influencing vascular changes leading to formation of plaque in arterial districts such as the carotid and coronary arteries. The value of triglycerides is being better understood through clinical trials that go beyond the evaluation of the effect of changes on LDL cholesterol over time. And most importantly, the guidelines from the NCEP that will be renewed at the end of 2009 or early 2010 are expected to provide a better positioning to the concept of non-HDL cholesterol, which of course includes not only the LDL cholesterol but also cholesterol carried by triglyceride-rich lipoproteins, which we know contribute to the process of atherogenesis. The newly discovered importance of inflammation in atherosclerosis is likely also to be linked to hypertriglyceridemia and release of free fatty acids in the circulation and into the artery wall, as fatty acids, rather than cholesterol, activate the transcription factors responsible for the upregulation and maintenance of the inflammatory state in the vasculature. In summary, I think the book provides a way to identify in one place metabolic, vascular, epidemiology, and pathophysiologic issues related to disturbances of triglyceride control and multiple disease states ranging from metabolic to organ failure, and linking it to consequences such as atherosclerosis.
Thanks for tuning in to the Experts in Medicine Talk series, brought to you by Handbooks in Healthcare. If you are interested in purchasing copies of this or any other titles by Handbooks in Healthcare, please call 800-860-9544 or email custserve@hhcbooks.com. All Handbooks in Healthcare titles retail for under $25 a copy and can be purchased in bulk quantities at substantial discounts. Handbooks in Healthcare can be found on the web at www.hhcbooks.com.